There are two types of exercise that seniors can do: aerobic and strength training. But which is better? Well, there is no simple answer because it all depends on your individual goals and current fitness level. Both aerobic and strength training have their own unique benefits and drawbacks for seniors. So in this video, we will discuss the pros and cons of each type of exercise so you can decide which one is right for you. Let's get started. Aerobic exercise, also known as cardio, is any type of movement that gets your heart rate up and increases your breathing and sweating. Some examples of aerobic exercises include walking, swimming, biking, dancing, and gardening. Aerobic exercise has many benefits for seniors, including improving cardiovascular health, increasing endurance, reducing the risk of heart disease and stroke, maintaining healthy blood pressure and cholesterol levels, improving balance and coordination, reducing joint pain and stiffness, boosting energy levels, improving sleep quality, maintaining a healthy weight, enhancing cognitive function and reducing the risk of dementia, and improving mood and reducing stress and anxiety. But unfortunately, there are also some potential drawbacks to aerobic exercise for seniors. It can be tough to figure out what type of cardio is best for you, if you have certain health conditions or physical limitations. Plus, some seniors may find it difficult to keep up with the intensity and duration of aerobic exercise over time. However, there are ways to overcome these challenges. For example, you can choose low-impact aerobic activities that are easier on your joints, such as walking or swimming. You can also start slowly and gradually increase the intensity and duration of your workouts. By taking these precautions, seniors can enjoy the many benefits of aerobic exercise while minimizing the risks. Strength training, on the other hand, involves using resistance to build muscle strength and endurance. This can be done with weights, resistance bands, or even just your own body weight. Some examples of strength training exercises include squats, push-ups, lunges, deadlifts, and rows. Strength training also offers a number of benefits for seniors, such as increasing muscle mass and strength, improving bone health and reducing the risk of osteoporosis, enhancing functional capacity and balance control, boosting metabolism and helping with weight management, improving posture and reducing the risk of injury from falls, maintaining independence and autonomy, and increasing confidence and self-esteem. However, like aerobic exercise, strength training also has some potential drawbacks. It is essential to use proper form and technique to prevent injury, and it can be challenging for some seniors to learn the correct way to perform strength training exercises, especially if they have never done it before. Another concern is that strength training can be quite intense and some seniors may not be able to tolerate it well, especially if they are not used to exercising regularly. However, again, there are ways to overcome these challenges. For example, seniors can start with lighter weights and gradually increase the intensity of their workouts. They can also work with a personal trainer or strength training specialist to learn the proper form and technique. By taking these precautions, seniors can enjoy the many benefits of strength training while minimizing the risks. So now that we've covered the basics of aerobic exercise and strength training, let's talk about which one might be better for you. If your goal is to improve your overall health and well-being, then both aerobic exercise and strength training are excellent options. In fact, it is generally recommended that seniors engage in both types of exercise for optimal health benefits. According to the Centers for Disease Control and Prevention, adults aged 65 and older should aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week. They should also include muscle strengthening activities that target all major muscle groups 2 or more days per week. However, if you are looking to improve your cardiovascular health specifically, then aerobic exercise may be a better choice. This is because aerobic exercise is primarily focused on improving the health of your heart and lungs. On the other hand, if your main goal is to maintain or build muscle mass and strength, then strength training may be a better option. Muscle loss and weakness are common issues for seniors, and strength training is an effective way to address these concerns. Additionally, strength training can help improve balance and reduce the risk of falls, which is particularly important for seniors. Now let's discuss the types of senior stretching. There are 3 primary types of static, dynamic, and PNF stretching. Static stretching involves holding a stretch for a period of time, typically between 15 and 30 seconds. This can help improve flexibility and range of motion, but it is generally not recommended as a warm-up exercise, as it can actually decrease muscle power and performance. Dynamic stretching, on the other hand, involves moving through a range of motion, such as swinging your arms or legs. This can help improve blood flow and muscle activation, making it a good choice for a warm-up. PNF stretching, short for proprioceptive neuromuscular facilitation, involves contracting and relaxing muscles while a partner or machine provides resistance. This can help improve muscle flexibility and strength, but it is a more advanced form of stretching and may require the assistance of a qualified professional. The best type of stretching for seniors will depend on their individual goals and needs. For example, if a senior is looking to improve their flexibility, then static stretching may be a good option. However, if they are looking to warm up their muscles before a workout, then dynamic stretching may be a better choice. Ultimately, it is important to consult with a healthcare provider or certified fitness professional to determine the best stretching routine for you. Now, let's move on to discussing the methods of senior stretching. There are 2 main methods, active and passive stretching. Active stretching involves using your own muscle strength to perform the stretch. This can help improve muscle flexibility and control. Passive stretching, on the other hand, involves using an external force, such as a partner or machine, to assist in performing the stretch. This can help deepen the stretch and improve range of motion. Another method of stretching is known as assisted stretching, which involves a partner providing support and assistance to help you achieve a deeper stretch. This can be beneficial for seniors who may need extra support or guidance during stretches. Seniors can also try self-assisted stretching, which involves using your own body weight and momentum to perform stretches. This can be an effective way to improve flexibility and range of motion without the need for a partner or equipment. However, it is important to listen to your body and not push yourself too hard, as this could lead to injury. One last method of stretching is called contract-relax stretching, which involves contracting the targeted muscle group before relaxing into a stretch. This can help improve muscle flexibility and reduce tension. Seniors can also try contract-relax antagonist contraction or crack stretching, which involves contracting the targeted muscle group followed by contraction of the opposing muscle group. This can help improve muscle flexibility and strength. The best method of stretching for seniors will depend on their individual needs and abilities. For example, seniors who are new to stretching may want to start with active or self-assisted stretching before moving on to more advanced methods such as contract-relax stretching. It is also important to consider any physical limitations or injuries when choosing a stretching method. Seniors should always consult with a healthcare provider or certified fitness professional to determine the best stretching routine for them. Finally, remember to subscribe and like the video. Thank you for watching.